I'm John Frutos. I'm here with Mark from Fluent Finance. In a previous interview we spoke about the associations that we try to help. One of them is Kudeca, which is here. We're going to have an interview shortly with Marisa Martin, who is one of the founders of Kudeca.
Okay, good morning. I'm Mark Elliott from Fluent Finance Abroad, and I'm here today at Kudeca with the president of the Elena Gaite Foundation, John Frutos, and Marisa Martin from the Asociación de Kudeca, one of the charities that the foundation is involved with, one that we discussed in our previous video with John. So Marisa, thank you very much for having us both here today. Can you tell us a little bit about yourself, a little bit about Kudeca, a little bit about the history, please? I understand it was started in 1991.
It all began when Joan Hunt and her husband Fred Hunt were confronted with the diagnosis of cancer. Fred was diagnosed cancer, a brain tumor, and Joan and Fred had retired early and had come to live on the Costa del Sol, and they had been now about 7 years really enjoying life on the Costa del Sol, and suddenly this terrible situation and moment came upon them. So Fred was diagnosed and he was put into the main hospital in Malaga, a big hospital, and it was very devastating for them both, not only because of what had happened, the diagnosis, but because they weren't understanding anything because of the language barrier and also the cultural and the system barrier. Mm-hmm. So she had a neighbor that worked in the little hospital where I used to work. And just the year before, we had set up a little palliative care unit, the first palliative care unit in Malaga. I am a doctor and I trained in UK in hospices, so I was trying to integrate some of what I had learned in UK. And because of this nurse, she contacted Joan and said, there's a little palliative care unit, there's a doctor that speaks English, why don't you go and talk to her? Joan came to talk to us and we transferred Fred to our unit. And that's how it all began in a way.
Okay.
Because of the neighbour of Joan Hunt and
right.
Because of the language barrier. Sometimes language in this situation can be very, very terrible, not to be able to understand what's happening.
So what happened, you met Joan,
that's right.
And how did that develop? How did that relationship develop?
We cared for Fred in the unit, I think it was like 3 weeks, and he passed away. And after that, Joan, I think a week after, came back from the funeral with a big donation. And she wanted to give it in to make the unit look more homely, because Red Cross Hospital is really a poor hospital. And she wasn't very happy with she was happy with the care, but not happy with the environment. So she wanted to donate it directly. And I said, oh no, you can't do that because it will just go into the funds of Red Cross. It won't come to our unit directly. And I sent her off to buy curtains and things to make the unit nicer. And she always told me afterwards, she says, I just wanted to finish and give you the donation. You sent me off to buy curtains. And when she brought a piece of material back, I didn't like them. So she got really cross. And that's how our real true relationship, because I was the doctor of her husband, but then it was a different thing that happened in a way, right? So Joan was a very determined person and she knew she wanted the unit nice. So she says, okay, well, you come with me now to buy the curtains. And that's how it began. We went to buy curtains for this palliative care unit. And so we worked hard, all the team really were very enthusiastic, getting everything ready. It was a curtain, it was nice tablecloth, it was nice pictures in the walls, everything. And we invited Joan to see the results. And we were all very excited, I remember. And I could see the disappointment on her face. So I said, well, Joan, you're not happy. We're all very excited. What's the problem? And she says, well, it's not exactly what I envisioned, Marisa. And I said, of course, you're envisioning a hospice, Joan, and that will never be in Spain because we're doing palliative care from the hospitals and blah, blah, blah. And she went home. And next day she says, I'm going to build a hospice.
Really?
She came back the next day and said, are you going to come with me? And that's how it began.
That's amazing.
It's incredible in such a difficult situation as she was.
And what year was that?
She decided. That was 1991.
So we're in this amazing building right now. You've been going since 1991. When did the actual hospice When was it created?
Okay, well, we began in 1991. Joan would come to my 24-hour duty nights, and we would begin to think about what we wanted to do. And we planned the whole project. Even this building was planned in 1991.
Okay.
Not this one, but a building, right?
Yeah.
And we knew that we wanted to have home care. We knew that we wanted to have the beds. We knew that we wanted to do a daycare center. We knew we wanted to care for the patient and family in the best way possible, with all the resources possible. I mean, doctors, nurses, psychologists, social workers, physiotherapists, another type of therapist. And we planned all that. But the problem was, as I used to say to Joan, okay, I know what we can do caring for patients, but where are we going to get the money from?
Yeah.
And she was totally convinced that that wasn't the problem. And she said, well, you know, Marisa, this happens in UK. Tell me why it can't happen here. People are caring, they look after their families. I know now, I've been living here in Spain for 7 years, you know, people are really generous, and it's just a way to motivate them. And they have to know what we want to do, and we have to set our budget and our target, and we have to go public with it. And I said, okay, Joan, and okay, I believe you. And but how are we going to get the public to know? She said, oh, that's easy. We do a press release. And I laughed. I said, but Joan, nobody knows you nor me who's going to come to a press release that we set up. And she said, that's not the problem, Marisa. What we do is we commit ourselves publicly to what we're going to do.
So you make a public statement
we went
about
and
your
did a
intentions.
press release, and with the budget that we needed to achieve to build a hospice. So we began fundraising in 1992 when we were constituted as an association first.
Mm-hmm.
In 1994, we had enough funds from the English community living on the Costa del Sol to contract, to do our first, hire the person that we needed. And that was fun too, because I said, okay, we're going to contract a nurse, Joan. We have to begin with the nurse. And she said, no, we're going to contract a secretary, Marisa. We have to make sure everybody knows that the money they're putting in here is going to the right place, and they see where their money is going to. And so we struggled a bit between both of us, but finally we contracted the nurse, and then I think it was like 3 or 4 months later we contracted the secretary.
Right.
And the treasurer in a way, although she was the one really doing the accounts. So that's how we began. We began with home care team in 1994, and in 1995 the Benalmádena Town Hall found it out that we were looking for a plot of land to build our hospice. And it was in Christmas 1995 that he came to us and said, I've got a land for you. So that was a big Christmas present, only 3 years after our constitution. And in 1997, we began building. It was incredible. The support from the English community living on the Costa del Sol was totally incredible.
Fantastic. So you've had support from Benalmádena Town Hall.
Yes.
Was that by accident?
Actually, Joan lived in Fuengirola.
Right.
So the first town hall we went to was Fuengirola.
Okay.
And actually, at that point, it was Esperanza Oña, and she's a doctor. So we thought, she would be interested in our project. The problem was she didn't have land. She said, and it's, if you know Fuengirola,
Yeah, you don't.
there's not much land there. So we hadn't really approached any other town hall. And actually, I live in Benalmádena. The mayor came to us, he heard about us, we were doing fundraising and we were doing lots of events and things like that, so he knew we were there, and he was the one that came to us. Our first little area where we used to meet was like very, very close to Joan's house, because we selected an apartment there to work from, and this land is really near to mine. And Joan always said, what is meant to be will be, Marisa. And she says that was meant to be.
That's
There's
true.
many meant to be in our history.
And in life in general. So the work that Kudeca does, please explain.
Palliative care is about caring for people that have an illness that is not curable, right? We approach the end of life from a holistic way. We need to not only control the symptoms, which is the basic thing that we need to do, but human beings were much more complex than symptoms. And when you face the end of your life, there's many other ways that produce suffering in you and in your families.
Yeah.
So we try to do that approach and support the patient and their family from total respect, for them to be able to cope with the situation in the best way possible, and to live this as peaceful and symptom-free as possible.
Yeah.
It's not that we're perfect, and many situations aren't perfect. They're very, very painful in many ways. But I think to have a patient that each day is going to deteriorate and going to get ill, and it's going to get worse because we can't control the illness itself, is very hard on the families. And if they don't get this support that they need, it's very difficult that patient doesn't end up in an emergency service, because it's very difficult.
Yeah.
So we have a team of experts right now in symptom control, compassionate care, communication, and bereavement, all the little things, communication, which build up the confidence that the family have to have and the backup that they need to be able to care for their loved ones, and for them to feel supported too all the way through.
As you say, there's a lot of help for the families that are here. I noticed that, unfortunately, 3 years ago, myself and my family. The support that we received helped so much, and it made everything so much easier for us. It was incredible, really.
Thank you.
So well done for that, because it's incredible, honestly.
It is really so difficult. I mean, and the doctors and nurses, we can do part of the care, right? We can support, but the really important part we can't do. We need you to be as best as possible to be able to love that person in the best way. So we're like, the ones that support the little things but what happens is because John and his family were able to be together, if it's in the hospice, if it's at home, but that's the most important part, that the families are able to care. And when you're overwhelmed with having to control the medication, going to doctors up and down, all that really deteriorates the situation. So we try to give that peace that you need through that support.
It's true, it helps. The loved ones can just care about that person. They don't have to worry about anything else.
At what point, John, was the decision made for Elena to come to Qadeka?
I think it was difficult first. They used to come to the house to look after her, and we initially felt that caring, the compassion that they had and everything. It was difficult for Elena to decide to come here, or see if you could come here, because obviously when you come here, 9 times out of 10 you're not going to leave. So the decision to go somewhere where you know you're going to spend the last few days of your life, you're leaving your house, you're leaving your friends, it was very difficult. But she was in so much pain, and it was so difficult that after saying she wanted to come, then no, then yes and no, she decided that she did want to come.
I guess you would have felt lost in a sense, because you've never been through this before. So to have Qadeka there to give you guidance, was that helpful?
The most important thing that they gave us is time just to spend chatting and with your loved one that's leaving. Because people don't realise that sometimes when they're at home, you've got 101 things to do, and you tend to not focus so much on the person, just doing everything else that needs to be done for them. Through coming here, the last 9 days were just more focusing on the person and just making them feel at ease and comfortable. People
idealise the situation. If I asked you right now, you might say, I want to be at home, I want to be this way, I'd like my end of the day, my last days to be this way.
Yeah.
But when you're in the situation, sometimes the team not all the situations need this, or it's better one or the other, but when we see it's too complex, we would recommend to come into the hospice, because it's exactly what John says. It's important to do what you have to do that nobody else can do anyhow. That love that you give, that peace that you can give, those last messages that are so important. We're not the ones to do that. We're at the back.
So you're there to support the family, to give them space.
It's not just families, they do fantastic work with the patients, because obviously Elena was so uncomfortable, and coming here she just changed. I noticed the change in her. She was more relaxed, the pain was controlled a lot better, she was well looked after, nothing we didn't want for anything basically. Everything that we needed on that side of things we had, and I was quite surprised. I think a lot of people don't realise what a fantastic job Qadeka do.
that's what I wanted to speak about. So the foundation, obviously you're the president of the foundation. It's been going for many years and you help different charities. Why is it important for you to support Kudeka?
Well, because really the foundation started in a way because of Kudeka, because of what they did for my family. I wanted to give back to them. So that is why really all this started snowballing.
In a way, it was exactly what Joan said would happen.
Yeah.
She knew you before you even were connected to us. You know, she had total faith in that people would understand our mission and would be part of it. It's not only to support us. She said we need people to engage with us and be part of the project. If not, we all fail.
As an organisation, Kudeka is in a good space now. So where are you guys now?
Kudeka has grown incredibly, but especially in the last 10 years. Why? Because palliative care was not known when we began. As I said, it was 1991. But now, many people know what palliative care is because they've had a family member or they've got a neighbour, so they can understand what type of care it should be. And the demand is very, very high. We don't only care for cancer patients, but we care for any illness in the last stage of life. And also we care for children now. We began, for the last 10 years we've been looking after children, but we decided to stop and redo the whole project. And it's like beginning Kudeka Hospice again, but for children. So we're now visiting UK, training and developing a project that integrates the same things that we have for adults, but adapted and especially for children. So we've grown a lot. We have the inpatient unit with 10 beds. We have the daycare centre, which is now being reconstructed to make it bigger because of the COVID pandemic. We had to close it down. So now we're making the facilities bigger and more safe for the patients and volunteers to work at. We began with a home care team in '94. We have now 9 home care teams. A lot of it's the need. It's what we need, but it's a lot of stress to support that too. And this building, the institute. The institute was on our plans since 1991, because Joan and I and Susan, we had clear that we not only wanted to care for patients and families, we wanted to extend this type of care within the healthcare professionals. So training and research, there's not really much research in palliative care. Nobody wants to invest money to see how to die better. People want to invest money for cancer to be cured, which is totally understandable. So, but we need to improve our care, and that's why we thought to having an institute to do training, to research and improve our care at end of life was important in our project. And also, it's our mission, but also we thought it could bring funds towards the care. So it's not only mission that we want to extend our type of care, it's also a way of getting funds to be able to care for more people. So this is possible just to the generosity and the commitment of a man who is very devoted to palliative care.
Okay.
He's Dr. Yusuf Hamid, and he has a hospice in India. He's from India, and he has a hospice in India like 3 times our hospice. So he actually lives in Marbella, and somebody talked to him about Kudeka, and he said, "Oh, I have to go and see that hospice."
Okay.
And that was in 2010. Yeah, it was 2010 when he came. And it was, he always says when he explains the relationship, how it began, it was love at first sight with Joan Hunt. And it was true. I think they both were people very generous with solidarity as one of their main commitments in life. And of course they identified values and they connected, completely connected. And they had a very nice friendship right until Joan died. And he was devoted to Kudeka. He's totally devoted to us. He's been supporting a room in the inpatient unit. He's been supporting the building of this centre totally. He's totally funded it, the equipment, and he's supporting it still.
That's amazing.
Yeah, really
So that one
amazing.
individual has really given Kudeka a big boost.
Yes, a huge boost.
Is there anything similar in Spain to Kudeka?
No, it's very strange how, through the years, because palliative care came to Spain through the national health care system, it's normally allocated within hospitals, and we have palliative care home care teams, but we don't have a centre specially designed to care for people in this way. So throughout the years, many people have come to see what we've been doing and say, oh, we're going to do the same. And Joan would say, oh, they're not going to make it. She could see. There are some centres that what they've done is integrated the environment as an element of care, which is what hospices do. Everything is designed to be caring and welcoming to the patient, but they don't get the funds from the community like we do,
Right.
because they have perhaps a big religion order behind them that supports them with the money.
Yeah.
But it's not community-based as Codeca. I think Codeca is the only community-based hospice that gets their funds from the community in all Spain, which is very, very much like the English model of hospices. Although in UK they are supported by the government,
Yeah.
right? Help the hospices. Here we've managed to have a contract with the local government so that we are part of their healthcare system.
Okay.
It doesn't cover much, but it's the only way really to care for the patients in a complementary way.
So you've
Not the
got
best
some
way.
kind of government support,
Yeah, it
For the work.
represents 20% of the whole budget of Codeca.
but it's a start.
We've been struggling since 2006. We had the first contract. We began caring for patients in 94, and not until 2006 we had the first contract for 3 home care teams,
Yeah.
and now we have 9.
And it's amazing to see how someone's vision, your vision and Joan's vision,
Joan's vision.
without any real support, can actually come to fruition. What plans do you have for the La Sala Golf and the foundation and the Elena Foundation to help with Codeca and their future plans?
Well, we're going to do another event shortly, probably September, October time. We've already done a few little things, and we've got the money, a little bit of money there put to one side. Hopefully get a little bit more from the next event that we do, and then pass it all on to Marisa and Codeca. It's incredible what they've done in the 3 years since I've been here. The change, the growth is incredible. What you've done is fantastic.
But it's
I said before, I'm sure Joan would be quite pleased. She might not like some of the books or some of the paintings you've got up, but hey, that's life.
curtains.
Yeah, the curtains, you need to change those. but yeah, it's incredible what you've done. And I think people need to realise this. They need to help in any way they can. Volunteers, anybody that can come and help, please do. Contact Marisa, contact Codeca, or come through me. Anything that can come that can help Codeca is fantastic.
One of the reasons why we're doing this, these videos, Marisa, is John obviously has, and John's family, La Sala Group, have a special reason for doing for getting out there and putting themselves out there to try and help Codeca and other worthy causes. But we have an audience. La Sala has quite a big audience. La Sala Golf has a big audience, and we feel it's important that you get your story out there, because hopefully someone may see this. One person may see this and be inspired like Joan was inspired, like you've been inspired, like the doctor from India has been inspired, which could give it an extra push.
I'm very grateful for that, and it's important that the same that we put so much care in the beginning of life, we are all aware that we will be there someday, and unless you die from a heart attack or an accident, you'll go through a process, and it's a good investment for oneself to support Codeca. But it's also, as Joan said, it's a way, in a way, of being committed to the community, to believe in people. And we believe that there are good people that are supporting us, and that's how we are able to do more things. The demand is very, very big. We're worried in Codeca right now. I was telling John that we had 7 home care teams. Last year we cared for 1,771 patients in
Wow.
1 year,
Wow.
mainly at home. And my teams after the pandemics are totally exhausted and are very worried because they carry the suffering of many patients on their shoulders, and they're very committed people. So
But the help that they give in the houses as well, you feel so comfortable and you look forward to them coming to the house because you know that they're going to help, they're going to give advice, they're going to, in general, everything that they do is just to help the patient and the family. And I presume they realise, but maybe they don't, how much help they actually do give.
they're on the telephone.
Yeah.
All days too. We have the telephone support for the families. But what I was trying to explain is that the pressure on Kudeka right now is so big that the teams aren't working like they like to, and sometimes we don't get in time to the patients, or we can't do as much home visits as we would like, or we don't get back to them on the telephone as soon as possible. So the Board of Trustees had approved only 2 or 3 months ago to get 2 more home care teams running, not 1, 2, because that was the need I presented to them from reserves. So we haven't really got the money to have those 2 more home care teams running and functioning. We've taken them from a reserve for 2 years. We've got 2 years to get the funds to be able to make that sustainable. The need is there, the people are demanding the care, and we want to give that care, but the demand is very, very, very high. So I think being part of Kudeka, like Joan said, is something that if you can, we need people to be. And you can be part of Kudeka in many, many ways. John has done it in a very impressive way. It's another legacy. It's another little story like Joan's, which will be a big story soon, John, I'm sure. And Elena was a special person. I didn't meet her, but I did speak to the people on the ward that treated her, and they all remembered her beauty. She was a beautiful person outside and inside, and you can see that when you're caring for people. So that's a way of helping Kudeka. That's a very impressive way. But, you know, being a volunteer, doing a fundraising event, considering us to be part of your legacy. When you leave your life here, you can still be caring for other people that you care for. So there's many ways of helping Kudeka, and what we want is people to be part of Kudeka, and that way we will be secure, and you know, we will feel confident that we will be here for many, many years.
Well, I honestly think that you will be. And I think hopefully myself and John and the foundation and the La Sala Group and my company will be supportive as much as we can.
Thank you.
And hopefully this interview today will go somewhere
I'm
towards
sure it will.
that.
I'm sure it will.
I just want to thank you and all your staff for everything that you've done and that you do. And as Mark said, we're going to be here to help as much as we can for as long as we can.
Thank you, John. Thank you. Thank you.